In this video, you will be learning about the Cumberland County Schools Suicide Intervention Protocol. The first thing to acknowledge is the importance of the Trauma and Loss Team. This team consists of school counselors, school social workers, school psychologists, school nurses, and at least one administrator. It is also important to have at least 2 people prepared and knowledgeable of the suicide intervention protocol in the building. This way, if one is out of the building, another is there to help. Even though there is a specific team that will perform the suicide intervention, anyone can refer a student. In most instances, teachers may be the ones to recognize the symptoms first, based on the student's interactions in class. The crucial piece is not ignoring those symptoms, but to report them immediately to a student services support person or an administrator. At the point of talking with the individual, it is important that the conversation is happening in a private place and the student is accompanied at all times. In addition, it is suggested that 2 interviewers be present, but it is also important to recognize there may be a time when this is not possible or in the best interest of the individual. It is also important to recognize limitations of what is expected of Cumberland County school staff. It is always necessary to contact a parent or guardian of the student if they have expressed suicide ideation or gestures. This is a CCS requirement. There are several resources that can be provided, including suicide warning signs and suggestions about how to keep the student safe. In addition, there is a need to have the parent review the parental release form and sign it. In the end, you will release the student to the responsible party for further action, but you may advise them on the need to go to the hospital or to make an appointment with a doctor immediately, based on the severity of the student's lethality. It is also important to remember a report of neglect should only be made if a parent refuses to comfort the student who demonstrates high lethality. Lastly, it is crucial to check back in with that student after they have returned to school. Remain normal, but at the same time help them plan ways to become more involved in an activity of their choice. It may be helpful to also obtain a 2-way consent form, so for the future you can speak with their doctor, and it is also okay to ask for proof of the assessment if applicable. Additionally, it is key to remember that suicide protocols are confidential documents and should not be included in a cumulative folder. Overall, suicide ideation, gestures, and self-harm are the realities of some of our CCS students. It is necessary to have people in the building that recognize how to identify the symptoms and respond in the appropriate manner. If you have further questions about the CCS Suicide Intervention Protocol, please contact the Student Services Department at the Central Office for help.